Good afternoon, everyone. If I could have your attention, please. Welcome to Policy, Biodiversity, and the Future of Food event. For those still finding seats, please go ahead and settle. I am Dr. Mohammed Abaji, and I have the privilege of welcoming you all, both here at Umrat Hall and online from around the world. We're thrilled by the tremendous response we got with this event. And I think that's a reflection of the urgency and the importance of the conversations we're about to have today. For those participating virtually, you can submit your questions through the Zoom chat function, and we'll try our best to incorporate them into the Q&A session. And for today's format, Professor McLean would deliver her welcome address and opening remarks. Thereafter, we'll have a 5-minute moderated panel discussion led by Dean Sandro Galea. And thereafter, Professor Laura Ayanati would deliver the closing remarks. We have a small reception here at Umrat Lounge. Would be pleased if you join us for that as well. Before we begin, please, may we ask you to silence your mobile devices and know that this event is also recorded for educational purposes. Now, to officially welcome you to this event, I want to invite Professor Marvin McLean. Professor McLean.
Good afternoon, everyone. It's a pleasure to see you all, and thank you so much for joining us, both here in Umrat Hall as well as online. I'm Marvin McLean, and it's my pleasure to welcome you to Policy, Biodiversity, and the Future of Food. So today's discussion could not be more timely. We face an unprecedented challenge. Only 9 plant species account for 66% of global food production. Nearly 1/3 of our fish stocks are overexploited. The world relies heavily on just 5 animal species for most of its meat supply. And up to 75% of the genetic diversity in agricultural crops has been lost since the early 1900s. The narrowing of agricultural biodiversity leaves our food systems increasingly vulnerable to climate change and shifting biotic and abiotic stressors. The implications are clear. In 2024, about 673 million people experienced hunger, and 2.6 billion people were unable to afford a healthy diet. Without more resilient and diverse food systems, these numbers are expected to rise, placing both food security and human health at even greater risk. But we're not here just to discuss problems. We're here to also explore solutions. So today's panel brings together leading voices in food security, nutrition policy, and biodiversity research to examine what policies and practices can help us build more resilient food systems. I'm delighted to introduce our moderator, Dean Sandro Galea, whose leadership in public health scholarship makes him the perfect person to guide this afternoon's conversation. Dean Galea.
Thank you, Professor McLean. Thank you, everybody, for being here in person and online. My name is Dr. Sandro Galea. As Professor McLean mentioned, I have the privilege of serving as Dean at the School of Public Health here, and I'm really honored to be moderating today's session. So I'm going to introduce our speakers one by one. So we'll start off with Dr. Gina Kennedy. Dr. Kennedy is Principal Scientist with the Alliance of Biodiversity International and CIAT. Dr. Kennedy's research focuses on the vital connections between agriculture, food composition, and diet quality. She's a leading voice in food biodiversity and was instrumental in developing the SDG indicators for women's dietary diversity. Dr. Kennedy, welcome. Next, Dr. Caleb Bay, whose research on maternal and child nutrition has shed light on how food system diversity affects the most vulnerable populations. His work on food security policy provides insight into translating research into practice. Dr. Bay recently served on the WHO Guidelines Development Group for Complementary Feeding. Dr. Bay, welcome. And finally, Anna Nelson, Executive Director of the Food Security Leadership Council. Before joining Food Security Leadership Council, Ms. Nelson served as Deputy Special Envoy for Global Food Security at the State Department. Ms. Nelson brings invaluable experience in reimagining U.S. leadership in global food security matters. Ms. Nelson, welcome. So format-wise, I'll be asking our panel some questions, and then I'll open up room for questions from the audience as well as from our virtual audience. So let me start with a question for Dr. Kennedy. So Dr. Kennedy, Professor McLean, I thought summarized well the picture. Your work with the Alliance of Biodiversity International has shown biodiversity loss across food systems globally. So for those of us who are not directly in this field, can you paint a picture for us? What does this look like on the ground, and how is it actually affecting diet quality for everybody, but particularly for those who are most vulnerable?
Yeah, great. Well, thank you so much for setting the scene so beautifully, and thank you also for the invitation to be here. We're here as part of a convening to talk about biodiversity for food and nutrition. So it's so wonderful to have this topic revitalized and have WashU to be leading us in this field. It's really great. So I'm really delighted to be here. Now, as we were saying today, as we were talking in our deliberations this morning, biodiversity and biodiversity loss and biodiversity use is actually a static concept. So those of us in the audience, I'm a public health nutrition specialist, but those of us who are breeders and plant genetics specialists, they know that we're losing species, traditional species, and then farmers are breeding new species and new varieties and cultivars of crops all the time. So coming to an exact number of what we've lost is very difficult, but as Professor McLean said, we are very heavily reliant on just a few species for most of our dietary energy. Now, the good news, because we don't want to talk always just about the bad news, the good news is that there's 7,000 species, and we're still counting and still trying to make that number even more precise, that we do rely on for food. So even though we're a little too heavily reliant on, let's say, rice, wheat, and maize, there's so many other species that we can tap into it, that are still available, that we still have access to, that cultures still work with, that people still know how to cook, and that can enter and be even more representative in our food systems. Let me think what else I might want to say about that. Just, I guess, like mostly, it's to have a message of hope and a message that, yes, we need to sort of bend the curve on research in the systematic review that colleagues have been doing. A lot of the research is focused on just a handful of these crops because breeders are focused on rice, wheat, maize, and our food system is focused on those. And yet we have this big opportunity to really kind of open up the lens and understand why we need to use biodiversity more. So we need to use it more to generate more ecosystem services, pollinator services, air quality, water quality, soil health, and then we also need it for human health because biodiversity plays a very special role. We need diversity in our diets, both for nutrients that we're very familiar with, like vitamins and minerals, but all kinds of bioactive compounds that are antioxidants, that help regulate our blood sugar, that help protect us from cancers. All of these bioactive compounds, and I can talk more, are very important also for our health. So there's so many roles that biodiversity can and will, I think, in the future be playing in our food systems.
So let's build on that a little bit. So let's now move from biodiversity to sexual health outcomes. So Dr. Bay, let's go to you. So when dietary diversity declines, let's start with maternal and child outcomes. What maternal and child outcomes are affected first, and what are the local conditions that either amplify or blunt these effects?
Thank you. So the first thing that we see when diet is not diversified is the risk of micronutrient deficiencies increases. And related to that, you would have cognitive development impairments in children, lower productivity as adults in labor market, and also increased risk to malnutrition, various forms of malnutrition, including overweight, obesity in later life that is related to non-communicable disease. And so it's diet diversity is a primary driver to the crisis in malnutrition that we're seeing today. About 150 million, according to the latest 2024 report of the joint UNICEF and World Bank estimates. This is among children. And so in light of what has been said in terms of biodiversity loss, on top of that, we didn't gain in terms of improving diet quality for even the youngest children in the world, and so leading up to a number of consequences in short term as well as in the long term.
Let me just ask a follow-up question to that. What are the conditions, the local conditions in different parts of the world that amplify the effects of biodiversity on children's health?
So biodiversity loss would be directly linked to what is available in terms of production diversity, what is in the supply, and that itself would affect the food environment, meaning at what price, what food is accessible, available, affordable, and that then shapes as well consumer behavior, the choice of people, what they eat, which would be then translated on the plate in terms of diversity of the diet. So there's a cascade going on. So, yeah.
So thank you. So we've gone from the picture of biodiversity loss then to its health impacts, and let's go sort of zoom back out to policy. So let me turn over to Anna Nelson. So Ms. Nelson, we've talked about now the science and the clinical frames. Let's talk about policy. So where are we at with US and global policy agendas right now, and how are these agendas affecting what we just heard about biodiversity loss, and their subsequent impact on child and maternal health?
Well, I think we're at an incredible moment where we get to rethink everything. We get to rethink how we've done things. And that's, of course, here in the United States, but also around the world, particularly in the development space. A lot of countries, development agencies, and major donors are rethinking in light of major funding constraints and the exit of the United States government from the scene. It's the United States has historically been such a leader in this space that it causes everyone to reconsider our approaches to these types of issues. So, as we think about the way forward, and the Food Security Leadership the Food Security Leadership Council, we stood up this summer to try to take the time to answer this question: where do we go from here? How do we use a sort of policy blank slate that has emerged to think about a way forward that is fit for purpose with our planetary crises? We have historically been so siloed in our sort of thematic areas of focus. You'll hear plenty of rhetoric about finding triple wins, but I don't know that we've been terribly successful in identifying the most important interventions that really truly can address biodiversity and then also dietary diversity, nutrition security, food security, and of course, all-encompassing climate challenges. And that's something that I think is so exciting about the school, that you guys are bringing together so many great minds from different disciplines to really try to figure that out and think through the way forward in a less siloed way.
So I like your hopeful note of time to rethink everything. There are many different ways of saying that, but I appreciate that way of saying it. But let's stay with you about the Food Security Leadership Council and just be a little bit more concrete now. So what are concrete 1, 2, 3 policy levers that in the next year, 5 years, might actually be used to improve biodiversity, improve nutritional outcomes?
Sure. Well, we've identified 6 pathways, we're calling them, essentially categories of the levers of government. One of those is international agricultural development. Historically, alongside humanitarian assistance, those are the programs of USAID and other official development agencies from around the world. That's one sort of category of activity. Another is multilateral policy. How do we use the mechanisms of the United Nations to raise ambition, to grow consensus around certain goals and translate that into action? trade policy. How do we think about our United States' own trade policies vis-a-vis the world, but how do we also work those goals into our diplomatic agenda with partners around the world? Research and development, funding for research and development. That's a huge policy lever, as I'm sure this room is all too aware. And then another one is public data, also something we've been focused on today. And that's something that I think a lot of the policy community doesn't ever think about. It's one of the many things we take for granted. But the availability of public data and what it is, what there's data about is we've learned a very political decision and one that can have a great influence on not just US policy and prioritization, but around the world.
If I were just to push on that for a second, what may be realistically achievable on any of those axes in the next, let's say, 5 years?
5 years. I'm very optimistic on the 5-year level.
Please be optimistic. Be optimistic. It's okay.
Food security, I think, and I grew up in the defense sector of all things, so I come to food security as a convert, so maybe I bring that zealousness. But food security has a superpower that is very needed in the United States, I think, and that is that it is understandable and important to everybody, and not just because we all eat, and we all understand the concept of, children and families around the world potentially not eating, but also because it incorporates all the other issues that everybody cares about: climate, biodiversity, even sort of national security and strategic concerns. There are real connections to all of these issues that I think can genuinely bring people together, unlike potentially any of those issues on their own merits.
Thank you. Dr. Kennedy, let me come to you. So we've talked a little bit about implementation and hope for implementation, which is wonderful. So let's talk about measurement now. So drawing on work that's out there in the world, including the Eat Lancet 2.0's emphasis on regional and local diets. So what indicators are we going to use to measure this? What indicators are we going to use to know if we've succeeded, if we've fallen short, and to add credibility so that we can track progress towards this hope that Anna is articulating?
Yeah, great question. Thanks so much for that. I'll start with one of the indicators that is very tried and true, was developed about 20 years ago and embraced by the Food and Agriculture Organization, and that's this concept of dietary diversity. So that concept is present in most food-based dietary guidelines, which is a policy tool to provide advice as to what makes a healthier diet. Now, just to explain a little bit, you are counting the number of food groups that somebody consumed in the past day. So one food group might be staple foods, so that would be, did you have any type of bread or pasta or anything made from cereals? Another food group might be dark green leafy vegetables, and yet another food group, for example, could be animal source foods. So it's a simple count of food groups consumed in the past day, and then to make it translatable, particularly for policymakers and people who like to have just one number, which is totally understandable, there's a cut point. So you need to have 5 food groups out of 10 to have a minimum acceptable diet. And that's been related to the adequacy of micronutrients, so vitamins and minerals in the diet. So that's a great one. And it will become an SDG, a Sustainable Development Goal indicator moving forward. So that's definitely one, that we'll be measuring, and the organization I work for is the Center for International Agricultural Research, the CGIAR. We have that as one of our primary impact indicators. But because the topic that we're talking about is actually biodiversity, we want to go deeper, right, than just understanding food group level. So we actually want to understand, actually, what are the number of species that people are consuming? How many in a day? Or how many in Ethiopia as compared to Vietnam or as compared to Colombia? And so for that, you need a different type of tool and a different level of granularity of your data collection. And there's a very powerful indicator that's been published and very well substantiated called dietary species richness. So it's a count of the species that you consumed. And in a big multi-country study through Europe, it's called EPIC, they looked at all-cause mortality and what's a driver of all-cause mortality and morbidity, and it was the amount of species richness is a very strong indicator of lowering your odds for all-cause morbidity and mortality. So we have a lot pointing to us about how important diversity is. And at another level, you can also even collect what are the different cultivars that different communities, cherish for cultural reasons. So these are things like, what is the variety of apples that maybe you can find in your farmer's market, or tomatoes? We have all different kinds of varieties of tomato. So you can also count the biodiversity within a food system, even down to that level. It's rarely done, but a few studies have shown that. So there's 3 different levels in which you can measure the biodiversity available on people's plates, and then you can also take that measurement of what people are eating and also look at markets. So within a market system, within a supermarket or a traditional market, how much of that food group diversity or species diversity or even cultivar diversity can I find? And so then we get a pretty good picture of how diversity is fitting into the food system. And of course, there are others, not myself, but others who look at the production diversity, both on farm and also within landscapes. So there's many ways that we can look at diversity and measure it. And I feel like initiatives such as this that we're embarking on for biodiversity for food and nutrition will help provide more interest and more impetus to begin to collect data at that type of level. Mostly we're collecting at food group level.
I can't decide whether to ask this question or not, but I'm going to ask it. What do you think is something that's really important to assess biodiversity and its impact on nutrition that we actually cannot measure, or that's really difficult to measure?
Yeah, well, it is very difficult to measure, it's difficult to measure the species level. That is, you need to have ethnobotanists, and we were just hearing the story from Madagascar this morning that they did a very, very nice job of collecting all the dietary intake data from consumers, and then they had to go back and ask the participants once, twice, 3 times, you mentioned that you ate this type of fish. We're not really familiar with it, so you need to kind of go back and actually try to identify what the species is. So when you're trying to get that level of granularity. And the other thing that makes it a big challenge is what is the nutritional value of some of these underutilized foods. So as a nutritionist, I want to know how much vitamin A is that giving you, or even more basic, how much protein or how much fat is that food providing to you as part of your whole diet, and we're just lacking that information. So we need to do also a lot more like systematic documentation of what we call food composition in our food system. And there is a project called the Periodic Table of Food Initiative, and it's trying to do just that. It's trying to really systematically document the nutrients in a wide range of biodiverse foods.
That's a great name for a project. Dr. Bai, let me turn to you. Let's talk a little bit about practice now. We talk about implementation, and sometimes I worry that the word implementation sounds good and it's abstract. So can we bring this down to the local level, community level, clinic level? What does actually good implementation of policies in this space look like? What does it look like on the ground? And what allows implementation to actually be successful, and what hampers it from being successful?
Thank you. So first I would say is to be in the shoes of the person receiving the programs and policies. So different interventions are happening that a person X, let's say, is receiving multiple interventions from every direction. Not necessarily just nutrition, agricultural intervention, health intervention, nutrition intervention, WashU intervention. The person is receiving all of that. It's the same person that's receiving it. So first thing is, it doesn't matter who's providing that intervention for that person. What matters is whether it's being delivered in the right way, whether there is crosstalk between the different interventions, whether they're aligned towards improving the well-being of that person. Those are the things that counts the most. But unfortunately, the way we're trained and the way we do things is so, for practical reasons, we have different departments, different ministries that rarely cross-talk or that go independently implement interventions that are proven effective, but how you implement it is important. And so one of the things that could be done is really for the research community to support the implementation of programs through implementation research. That's basically not just the what needs to be implemented, but how, in what context, what could be done to adapt the efficacious program to the reality on the ground, and how should programs talk to each other in a way that we maximize from the investments made. I would like to bring to your attention for an example. So we just published a paper where we were looking at multi-sectoral coordination. And nutrition, as I tried to explain, the diet that you're eating is driven by so many factors. Whether you have road, the access to markets, the access to healthcare, multiple, wash, access to water, hygiene, all of that plays into your nutritional outcome. And so in Ethiopia, for example, since 2013, the policy landscape recognizes that there needs to be a multi-sectoral coordination. So that the fact that there's need for a multi-sectoral coordination is given, it's known. But the challenge they're facing always is, okay, yes, very good, but I'm in agriculture, I have my KPIs, I have got my deliverables. This is what I'm going to focus on. And so there's a limited alignment of activities on the ground. And one exception that we found is a program called the Sakota Declaration in Ethiopia. And we're looking at it from the lens of collective impact. For programs that are complex, dealing with complex issues, there are a certain set of ingredients that need to be fulfilled to have a higher chance of succeeding. So one is the common agenda. So what are we looking for? So in the Sakota Declaration, it's to end malnutrition by 2030 among children under 2. That's the driving, that's the North Star. So they would define common goal, then shared measurement. What do we mean? What is success? For me, in agriculture, in education, in health, in WashU, so different sector ministries now that are committed to ending malnutrition, what does success means in my sector and along with the other sectors? Then you need to reinforce the activities. You need to have mutually reinforcing activities in a way that what is done in WashU is supporting what's done in health, and what's done in health is supporting in agriculture and vice versa. Then you would also need to have some agreed upon measurements, shared results and measurements. So when you deliberately try to address all these different segments, you're likely to have a better coordinated program on the ground that makes sense, that is likely to have a better impact. And we've seen it in the Sakota Declaration. And one way to look at it is whether, in Ethiopia we had government change, we had civil war in the last 5 to 6 years. In spite of that, this is one of the programs that has continued. So it's withstanding COVID, it's withstanding war, it's withstanding budget shortfalls, and all of that because there was this alignment across multiple domains that are important. And to finish off in this, also we need to think of how to break silos in the data landscape and how we use data. The data may be there, agricultural data may be there, nutrition data may be there, but when it's available, it's only serving that one purpose of nutrition, agriculture, it's a yield prediction, or it stops there. So a lot more effort is needed to integrate, harmonize, various data sets in a way that it starts to crosstalk, like we are expecting that from the program implementers. We also need to do the same in the research to start crosstalking, to use the data, make the data crosstalk across disciplinary boundaries and beyond. Thank you.
I have a lot of questions, but I'm going to discipline myself to just one follow-up. So I thought it was a really nice answer about fundamentally on the ground what it means to implement properly. Tell us a little bit, what are the key actions to implement equitably? How do we make sure that implementation actually reaches everybody rather than creating more gaps and implementing in a way that reaches those who are easier to reach?
So one is to make sure that it's measured and we don't leave out people from our measurements and monitoring activities. Two, it's on the way we design the program. We need to adapt it to the different contexts. Let me give you an example. We know an efficacious program would be to provide iron, folic acid, or multiple micronutrient supplement to pregnant women. We have enough data, a number of clinical trials, meta-analysis. It's all clear. This is one intervention, proven intervention. But in a context where you would need to walk or drive more than 4 hours to get to the nearest health center in parts of Africa, this intervention, unless you deliver it in a different way, your model of delivering it through using the health system is not reaching those who are the most vulnerable. So adaptation is needed, not just counting coverage, what's the percentage people reached, etc. It's really to understand, okay, in this context, how can I make sure that this efficacious program is designed in a way and implemented in a way that it reaches the most vulnerable. So that exercise, I think we often fail as in academics as well, where we provide the evidence that it works, understand a bit, describe a bit the context, but never link the two. And so some backing from academics would support a new form of research that is dynamic, adaptable, agile, and aiming to address existing problem on the ground.
Yeah, I like the focus on intentionality, that fundamentally you're not going to narrow health gaps unless you focus on narrowing health gaps. So let me go to Ms. Nelson, ask you sort of a question that builds a little bit on that. So I thought Dr. Bai did a very nice job of talking about the need for resources, the need for will, the need for accountability, which I thought all emerged from the answer you were giving us. So as we move to growing attention to the entirety of food systems with social forces, things like power, equity as well involved, what would it actually take to, in this moment of rethinking, to use your word, to actually mobilize US and global leadership around goals to make sure that we don't have people who are left behind in nutrition because we are failing in our food systems?
Yeah, I think this is sort of one of the major philosophical tensions of foreign assistance. We all know that all these solutions are interrelated, but organizations have to have seams. There are always bureaucratic incentives and disincentives to collaborate, and transaction costs to collaborating. So how do we sort of acknowledge that a systems approach is necessary and that we will, as humans, end up in separate teams in different ways, but still try to have a coherent response? And I do think it is taking this crisis moment in policy in this space and investments in this space to think deliberately about how to integrate things better, not thinking about biodiversity and food security or agriculture separately, for example, and asking our partners around the world to do the same, I think particularly in the donor community. How can we create mechanisms that we can all buy into that are politically palatable to the many, many constituencies at the table, and that consider partners equally in terms of donor communities and recipient countries. So I think it unfortunately is going to take a lot of sort of leaving egos at the door, which is, tough in Washington, D.C. But we have to recognize where we have failed to do that and think about why. And I'm a big believer that there are sort of bureaucratic incentives and disincentives that can be shifted to try to get at that, both in a country where we're trying to affect policy change, but also in systems that are trying to facilitate the way ahead. So maybe that was a cop-out, but there we go.
But you're still hopeful.
I'm still hopeful.
Let me ask Dr. Kennedy one question. Then I'm going to ask a couple of questions for the whole panel, and then I'm going to open it up for questions from the audience. So, Dr. Kennedy, we haven't actually talked a little bit about indigenous and traditional food systems. Can you talk us through how we would scale availability to indigenous traditional foods? Maybe give us an example of successes we can emulate and guardrails to make sure we don't go wrong.
Wow, that's a pretty tough question. So I feel like safeguarding traditional and indigenous people's food systems, starts with them. And there's a saying now, nothing for us without us, and I think that is very true. You do nothing for people without them. So if you're going to work on indigenous people's food systems, you go to the communities and you explain, what are the issues, and let's see how we work together on your food systems. What is it that you're interested to document? In the project that I mentioned, which is the Periodic Table of Food Initiative, we are trying to establish kind of more scientific data and have that be in open access platforms as a global public good. But you have to be very careful when you're approaching indigenous and traditional food systems because they have to agree that they would like for you to have that knowledge and that they would like for that knowledge to be open access. And sometimes they don't want to. And so it's kind of a matter, again, of, well, let's discuss why it would be beneficial to have that knowledge open access, and let's discuss how you would want to restrict that knowledge. And a very interesting example comes to mind, and I think it's a very good example, and it's from Kenya. The government of Kenya is investing in documenting their local biodiversity county by county. And they have a very beautiful methodology whereby they're training youth that come from the county to use photo voice and photo documentation, so photography and audio, to interview people who have knowledge of what can you harvest out of the forest, what kind of mushrooms, what types of insects, what kinds of fish, everything about the food system, all of their biodiversity. They're documenting it very carefully, but they started off with getting free prior informed consent from the communities, and also a very strict data sharing agreement that says you, the community, will be the stewards of this data, not the scientists, not the researchers. And so the Kenya museums, who's doing the documentation, they'll give you, this is what we found from this county, these are maybe the species lists, but if you want to know more, then you need to go and talk with the county leaders, the community, explain what you want to do with the data that they have, and then they have to agree that they'll give it to you. So I think we also, have to really recognize that there's, a lot of things we've done wrong, as researchers and, as people with different motivations to work with indigenous communities, and have to be very careful to let them lead and let them decide what information that they want to share and don't want to share. So there's different models, but I think the Kenya model is a nice example of, and that's what the government of Kenya has decided to do, and they're following very precisely. And not only that, they're backing it with funding. So they want to document their food biodiversity, but they also want to do it in a way that respects the community's right and over that information.
Thank you. All right, so I'm going to ask a few now for the whole panel. These are like popcorn fast questions, and then we'll move to the audience. We'll start with you, Dr. Kennedy. And we'll go that way. What's the single most underused policy lever to improve diet quality at scale in low and middle income countries?
Well, I would say that the most effective from the reading that I've done are fiscal policies. So policies that both, and I'm talking writ large about a healthy diet, and we haven't really discussed in this panel on biodiversity, but a lot of our diet is made of foods that we want to moderate. For example, 60% of the dietary energy intake in the United States is from what we call ultra-processed foods. So biodiversity aside, we would want to be moderating those foods. And so some of the most effective measures to get dietary change, which would also incentivize other aspects of biodiversity like fruits, vegetables, pulses, would be like both taxes and also then incentives and subsidies for healthier foods.
Dr. Bai, most underused policy lever?
Most underused. That's so I think it's in the financial support given to programs, the way it's designed. If designed better, I think it would incentivize to see the kind of change we anticipate. And so some work in that area on adaptive management, adaptive program delivery and evaluation in a way that incentivizes creativity and making sure that whatever we do meets the context could get us a long way.
Nelson?
This might be unorthodox, but I would say ruthless prioritization. Our issues are so vast that we can't tackle them by sprinkling around our activities, our resources, our brain power.
I like ruthless prioritization very much. We'll start with you now for the next round. Just to be fair, if you had to choose between making healthy diets cheaper or unhealthy diets more expensive, which is more feasible and why?
More feasible? I'll leave that to my evidence-based colleagues here. You know, I do worry about the sort of inherent fact that healthy diets and sustainable diets take more resources and are more expensive, and we wouldn't want to change that. So I will cast my vote though for a carrot and not a stick, and incentivize healthy diets.
That's consistent with your hope theme. Yes. Caleb, if I may. Healthy diets cheaper or unhealthy diets more expensive?
I would take that as part of a same continuum. And,
that's a good dodge. Yeah.
With the carrot, healthy diet's cheaper.
Okay, very good. Now we'll start this way. Where are we over-investing based on weak evidence, and where are we under-investing despite strong evidence?
Well, these questions keep getting more and more difficult.
I'm sorry. Well, now we've warmed up, you know. It's
I don't know. Have an easier one. Well, I do feel like we are over-investing in the same thing that we stand on these podiums and talk about all the time, which is the priority crops. So rice, wheat, maize get so much investment, and fruits, vegetables, pulses, fish, aquatic foods, insects, mushrooms, where is the investment? So we're completely over-investing. We're obsessed with staple foods and grains, and we have not invested enough. We've really under-invested in what supports our life, the biodiversity on the planet. That's not a staple grain.
That's a good answer. Caleb.
I think we're under-investing on efforts that will lead to a better contextualization of whatever program we implement. So more on the implementation side and in what context what could work. There's I think in my view under-investment in that area. overinvestment into the same programs that keep hitting the wall.
Right. Thank you. Anna.
I think we need to be clear-eyed about the importance of increasing sustainable productivity and productivity gains. So as we think about investments and things that might be good at a smaller scale on biodiversity, do they also allow us to increase food production for a growing population while protecting our natural lands and using that as our measure for prioritizing investment?
Okay, last question for the whole group. You're going to start first. What's the top risk of unintended harm from well-meaning food policies?
Good question. The top risk. I think maybe trying too much to pick winners and losers. I'm just thinking of our biodiversity theme, and diversification in the biodiversity context and every other context is a source of strength. So maybe I'm contradicting my earlier point about ruthless prioritization, but I think diversification is an inherent strength, and we should be cautious about putting all of our eggs into one basket because that's inherently vulnerable.
One of the risks that I think
Caleb, can you lift up the mic closer
Yeah.
to the mic?
So it's the prioritization of low-hanging fruits, whether they lead to the kind of outcomes we want or not. It's always the easiest, the quickest that gets favored.
Thank you.
I think that our top risk is not investing enough in education of younger generations, starting from, when you're born, going through primary school, because everybody needs to know, where did my food come from? Is this food on my plate from, I live in the United States, is this food on my plate from Brazil or Malawi or Chile? And how was that food produced? Was it produced in a sustainable way, or was it produced in an extractive way that's taking down the rainforests? And so we need to really invest in educating from the youngest age possible the importance of the food choices you're making, important for your health and also important for the health of the planet.
Thank you. Let's open it up for questions from the audience. I believe there are mics in the audience. Who would like to go first? We're going to borrow a mic. Right there.
Thank you. What's the role of technology here? So I think it was Dr. Kennedy mentioned that there's a strong correlation with human health and just the number of species that you eat. But obviously there's a big cost in, just getting those species as real individuals. But, is it just the elements that are the stoichiometric elements in these species that you need a big diversity of? And can we just use tech somehow to kind of get that diversity of molecules and elements that humans need to live a healthy life?
Who would like to tackle that?
Yes, I would love to have all these techie university students help us sort out how to collect more information using digital, using photo imaging, because we really have a lack of data. I mean, there is always some hope, and there are countries, as Shelley here from GACE has pointed out to us today in our discussions. We do have national surveys now from Nigeria, from Ethiopia, from other countries in Africa that we didn't have before, from countries in Asia. So there is a push to do it, but it's very costly and it's very time consuming, and it takes about 2 or 3 years, 4 years sometimes, from the start of the survey to actually get the results. Can we please have tech? Please help us. It's got to be faster. There has to be a better way to do it. So I think there's tons of opportunity to use tech in the dietary intake assessment and species assessment realm of the work that we do.
I'll add to that advanced analytics that helps us to see patterns that we couldn't see before. And so, machine learning, AI, etc., could be used in some form or another to unravel some of the complexities, some of the drivers that we didn't pay attention to, and maybe paying attention to that could help us as well.
Let me go to a question from our virtual audience, and then we'll go to another one in the room. We haven't talked about corporate structures and large agricultural monopolies that are a large part of the global food systems. So how does one grapple with that sort of corporatized profit motive, and how do we make sure that there is an incentive for a healthy profit to align corporate incentives with our biodiversity and nutritional goals? Hannah, would you like to start with that?
I think one of the major sort of threshold issues is strong governance and strong investments in public foundations for innovations and research and development. And those investments, both in sort of the policy levers of strong governance and also public R&D, allow us to open up the industries and bring more players in. I mean, certainly the issues are deep across so many sectors, but without even that kind of basic foundation, I think it's hard to find a way forward.
Somehow it's also the way we organize ourselves, being fragmented, that helps create opportunities for unintended, for the corporates to manipulate those fragmentations. And the more we are clear on our goals, and the more we are clear on what is the impact of a certain action, not just on what I see, but also for other ministries, for other sectors, we would stand the chance to say, okay, this is not all good. This can have this negative impact on this outcome. And based on that, try to navigate and put guardrails so that we manage this carefully.
Hello. So my question stems from something that Dr. Kennedy mentioned when you spoke about the work that's being done in Kenya and what they're doing over there to try and right the wrongs that have happened. And my question is, what can be done, or what investments can be made to right the wrongs of our polluted soil that we have here in the US, or even just in this region, to kind of make it a little bit of a more granular focus so that we can have a better chance of having healthier crops so that we can eat better?
Yeah, thanks. Great question, and I'm glad you appreciated the example from Kenya. So, for me, biodiversity is the answer. So if you want healthier soils, then you need to have more biodiverse soils and work on how to make soils healthier through use of more biodiversity. There's many different practices, and I'm not a soil science specialist, but composting, and there's many ways to low tillage, different practices that will make soils become healthier, and then sustain a healthier environment for agriculture.
Let me ask a question from Zoom. This is a question from Nigeria, and maybe Ms. Nelson, you can start with this. And the question says, I've noticed in Nigeria, as we lose some of our native foods, newly found foods are actually more costly than the native foods that they seem to be replacing, so leaving us with an unbalanced access to a healthy diet. So what could be policy levers to actually balance that out, to ensure that as we move to newer foods, they are not ending up shutting people out of having a balanced diet?
That's a really interesting point and question. One of the things that we worked on at the State Department in the last administration was something called the Vision for Adapted Crops and Soils. And the purpose of that was to grow support for what we called opportunity crops, others call it underutilized crops, And as we thought about that, of sort of bringing back in many cases, traditional and indigenous crops, it was how can we do so in a way that works for the economy? So it's not just a question of making sure farmers have seeds, but how do you look at sort of the entire chain to the consumer to make sure that, that they can access it, that there's a demand. So I think, you know, as communities think about how to diversify their diets and which food sources make sense in terms of means of diversification, that criteria be involved, and that our investments are geared towards that result in mind, that there's access to them.
So this is Xinyi Liu. I'm a professor of anthropology. I'm an archaeologist of food, and with a particular interest on some of the neglected food resources from deep antiquity, from deep history. So I guess my question is about the cultural dimension of all this. It's always a strike to me that when biologists, and in this case the food scientists, are talking about lots of biodiversity, very similar to the way in which anthropologists and the linguists are talking about the lots of cultural diversity. And I always think the two systems geared up with each other, come hand in hand. We eat on the one hand for the sake of biology needs, but always we eat for maintaining a social ties and sometimes to form a social boundaries, so on and so forth. So there's always that cultural dynamic. So I want to ask the panelists thinking about whether there's any thinking about maintaining that cultural diversity as a mechanism, perhaps through education or through other mechanisms, in order to achieve some of the challenges that we're facing in terms of biological and the nutrition diversity.
Who would like to go first?
Yeah, thank you. That's a great question and a really great point. Sometimes we get caught up in the research and the science, but the culture of food is equally as important. And, you know, that's where biodiversity brings so much diversity of tastes, of textures of food, of colors, and to your point, of cultural ways of preparing food. And so it really is not only about what is the food on the plate or what is the food that I ingested, but all of the things that led up to the food getting there. And so there is definitely, you know, so many elements of these are traditional ways of preparing the food. We were talking even today, my colleague Ramya was saying, you know, if we're going to have chickpeas, we soak the chickpeas, and you might do that with your family, or, you know, you might shell the beans or the peas or whatever as a family kind of gathering or traditional gathering. So there's a whole bunch of very important culture and bonding around food. So I spent 15 years in Italy. They are very, very bonded around food. And to my point about starting young, my son went to what they call scuola materna, so he was age 3 and 4 and 5. They taught them about food every day. Every day they had a diverse, different plate of food. They eat so many different types of vegetables and fruits all within the season. So a lot of it is about learning it young and also not letting go of your cultural foods. And so it's a very, very good point. I'm very glad that you mentioned that, because food is culture, and it's very important to be reminded how important that is.
I just want to add that, yeah, so in cultures where you sit down, eat together as a family, as to maintain that, because it doesn't allow you to grab something quickly, usually processed food. So that could be one way to circumvent some of the changes we're seeing, but it's also important to recognize that culture would evolve, and so there's need to work on it to maintain it. So making it interesting again to sit together, to take your time, etc. That could be the modern way of living. It doesn't have to be an ancient way of living. So designing it in a way that it's aspirational to the people so that they maintain their culture is important.
As I invite Professor Iannotti up to the stage, please join me in saying thank you to our wonderful panel and for being such good sports, even with the difficult questions.
So I want to reiterate that. Thank you, exceptional panelists. What a scintillating conversation. And to the stellar moderation by our dean and his remarkable leadership. I also want to acknowledge the thought leaders who are participating in this Ozark convening, who have traveled from around the world and from St. Louis. And tonight we represented the sort of public health nutrition side of the equation, but in the room with us, we have ethnobotanists, we have ecologists, we have Missouri Botanical Garden and other botanical gardens representing this sort of biodiversity side. So it's a real experiment in that interdisciplinary work. So I timed you. You spent 6 minutes on the dire circumstances in biodiversity and malnutrition. I think 3 from Morven and 3 from Dr. Baer. But you spent 54 minutes on the positive side. And that's one of the takeaways that I have tonight, is that there are lots of opportunities to make change. The policy levers that were mentioned, the data that we need, the practice, and sort of permeating all of this was the equity and making sure that nobody's left behind. So thank you, and thank all of you for coming out in the rain. Please join us in the back for reception in the Umrath Lounge.